in childhood, then kids are trying to gain some independence and some competence. And so the parent's role shifts a little bit to teaching emotion regulation, right? And again, I think I put some of these things on here because I think some families need to know this. They need to understand that, for example, if my child is, so I have 3 children, let me say that. I have a 14-year-old who's 6 feet tall and really silly and weird boy, a 12-year-old who basically has clinical OCD but isn't treated, and a daughter who's really dramatic. Okay, so, and the oldest was really hyperactive, so they're all, it's behavioral therapy at my house all over the place. My 12-year-old will get really anxious and dysregulate, and it's my job to try to teach him how, and so I'll give you an example of that. My boys have bedrooms next to each other, and there's a bathroom in between, and there's a shower in there. So every evening, they fight over who takes a shower first, okay? We do this every day. We brush our teeth every day, too. I don't know why this is a problem. Anyway, and my younger one, the 12-year-old, if he has it in his mind that he's going first, and he's not then the one to go first, he gets very upset, and he'll start freaking out, crying, yelling, it's not fair, whatever. And he doesn't do change well. He's a little on the edge of the autism spectrum, as you probably tell by that. Very high functioning in that. And those are some of the moments where he has trouble. And so there was one particular day where we had this lovely breakthrough. He's crying and saying, it's not fair. I was supposed to go first. I was supposed to go first. And he went first, and it's not fair. And I said, you're not allowed to say that again because you're just repeating yourself. And I don't want you to think about that. I want you to take your shower, and after you're out of the shower, you can come back to me and we can talk about what happened, okay? So I closed the shower door. He said, it's not fair, it's not fair. Closed the door. I left. 10 minutes later, out he bounces. Hey, Mom, totally forgotten. And so one of the things I learned is how good an emotion regulation skill it is for an anxious kid to put something out of their mind. And so we've used that. We've said, do you remember how much better you feel when you put it out of your mind and you set it aside? And so he can use that again. And again, I'm lucky enough to know that this is part of my job and to continue to use this and to look forward and think, well, what's he going to need when he's 18 and 20 and prepare him? But a lot of families, I think, are not aware that that's part of their job. And of course, supervising relationships and modeling problem solving. There's been a lot written about how beneficial it is to kids to see their parents have a conflict and make up, for example, to see their parents, have a disagreement, or see their aunt and uncle or their mom and the neighbor walk through something and see them figure it out. I think people understand that they're doing that, but maybe not the nuance of all the subtlety, that if I get into a conflict with my neighbor about the fence line and I behave badly, right? It doesn't really matter how right I am. My children are learning from how I handled that. And likewise, if I negotiate that well and they walk through it with me and see what I do, they're learning that too. All right, preteens, of course, are dealing with their changing bodies. And they're dealing with their feelings that are increasingly complex. And so during this time, there's an increase, part of the parent's role is to be attentive to that. And so I've seen some mortifying things, for example, increasingly, kids who are engaged with predators online, particularly 11, 12-year-old girls who are preteen, they have hormones, they're kind of growing interested in romantic attachments. They'll get involved on some kind of online format with a stranger, and it'll turn out to be an adult who's trying to make contact with them. And so in one case in particular, the parents were not supervising any of the online activity. The child was online all the time, and a 34-year-old man showed up at their house wanting to pick her up, and claimed to not know her age, but they met on a child's game. So I think, it's really important right at this point that parents begin to think about supervising their kids differently. And I think a lot of our families don't know that. They think about that in the teen years. right? You supervise for sexual contact or impropriety, maybe a 15-year-old. But to start at 11 or 12 in the tween years is actually important, and I think people don't know. The particular father of that girl who had given her unlimited access broke down sobbing and said, I didn't know, I just didn't know that this was even a thing that could happen. Talking to kids about all of those things is also important. Talking about how your body's going to change, talking about how your relationships are going to change, I think is an important thing. And then, of course, letting them be kids, but prepping them for the teen years, beginning to talk about the complicated subjects. And so a lot of people around this time will have the intuition to have a sex talk. I'm personally of the belief, so I teach the sexuality and sexual disorder seminar. My recommendation is that actually happen around age 8, which for a girl is on the edge of the tween years, for a boy it's not. And so just FYI, the reason I recommend that is around that age you get a real scientific interest in how the body works and not a whole lot of sexuality of any kind. So you can sit down and you can talk about the biology and the body and show pictures, and they'll listen to that. If you wait until sexual desire, and so if you have the sex talk with a 12-year-old, particularly a 12-year-old girl, right? The onset of menstrual cycle now is about age 10. And so if you're talking to a 12-year-old who's already embarrassed and already having hormone changes and having private thoughts and feelings, you're gonna maybe not get as far as if you'll go through all that information with a slightly younger child. I see people making faces like, oh no. Okay.
I completely agree. I have a 7 and a 9-year-old, and we talk very scientifically. I mean, like, I divert conversations from, like, we're the poop jokes, and I'm like, so we start like, hey, did you know that they like gardening? So then we talk about like how we use poop to fertilize, and so we twist it around. So I completely
right. You bring in the science there, and so. And it's really interesting because I think that, so I have a really good sex talk book that I went through with all my kids right around that age, around age 8. And my boys were very embarrassed. And both of my boys actually said, wait, did you and Dad do that? Which I thought was interesting, the exact same phrase, like, that's weird, and did you and Dad do that? And so they're really fascinating. But, and my girl was like, okay, But all of them would go in their room and just look at the book and like just try to understand. They're just like, I'm just trying to figure this out. And so I think it's important to understand that right around that the prepubescent and the social and emotional changes, the window starts to close for a lot of these things, and we need to catch it before they get to this point,
I have a question. So you were saying for boys, age 8 was like at the edge of, so you're saying like age 8 for a boy is kind of late, or it's at the right time?
Yeah, so girls tend to hit puberty earlier. Yeah, and so age 8 is fairly ideal for a boy. It's potentially a bit late for a girl, because if the onset of menses is 10 on average, then you've got some 9-year-olds and even younger, and you've got some hormone changes that have already started, and you've got an audience that might already have a lot of bias in terms of their own body and looking at pictures of development. The book that I use shows pictures of a developing body. This is a baby's body, and this is a little girl, and male and female, that they all read the same book. And this is how the body changes or something. Well, if you're looking at a kid who's already going through development, that might be embarrassing. It might be really embarrassing. And so trying to catch it earlier. But with a boy, you're usually going to be safe. You're not going to be hitting puberty. The one exception I've seen is some of the kids who are on medication and they're have significant weight gain, and they'll hit some of the puberty markers earlier because of the weight gain. Yeah. All right, and so in the teen years, and again, like this is a subject that's been talked about and looked at and examined more. Parents supervise and emphasize emotion regulation, of course, teach skills and prepare for independence. And I think part of that around the teen years, and that I want to note, about teenagers in general is there's a whole lot of research that indicates that teenagers misread emotion, particularly as aggressive or angry, right? And so again, those of us who are here, we probably know that, but do our families know that? I find that that's one of the most helpful things I say to a mom who comes in and says, he just lashed out at me. And I say, oh, you were anxious and you were worried about him, and your voice went up and he thought you were angry, because that's what teenagers do. They see anger everywhere. They see aggression everywhere. And so parents need to know that that's a common thing, and be informed and be prepared to deal with that. Be prepared to say, one of the things I think, and again, I have a 14-year-old who lives in my house, and I'm constantly saying, do you hear your tone, buddy? Because that's not respectful, and he can't hear it because they don't see themselves the way they sound. They sound more hostile than they think they do, and they think we sound more hostile than we sound to others. And that's a common error of adolescence. And so the emerging adult stage, you have an adult, very often 18 to 25, even maybe 29, depending on what's going on, but they need adult skills. So you may have a growing issue where I see people who come in and they'll say, I've never done taxes before. I don't know how to do taxes. My mom does that for me. And so I might be dealing with a 25-year-old. And I say, well, this year I think it would be helpful if you sat down with your mom while she's doing your taxes, because she's not always going to be here to do your taxes, and you need to know how to do that. Right? And so saying that to parents, your 25-year-old, I know he has a lot of anxiety and I know he worries about these things, but you're not always going to be here, and you need to sit down with him and let him learn to do this, because he's got to learn as well. And so that's a role of parents. Accountability and responsibility, something I end up talking to people a lot about is, if your daughter dropped her classes and she's done this repeatedly, how are you going to create an accountability structure? And so what I suggest to them for that might be that they look at how much money they would have spent on college if she had been responsible, and they tell her that's your pool of resource, and we're not on the hook for the 7-year plan. So we're going to support you this much. And if you're not ready to graduate at the end, then you'll have to figure out how you're going to fund the rest, if that's work, if that's get loans or whatever. And that's holding her accountable so that she can make better decisions. And then helping them to transition to independence. And again, increasingly, I saw a situation where there's a 25-year-old who went on a car trip and went with his girlfriend and took off several states away, and then had a spin out and damaged his tire because of ice or something, and locked up and couldn't do anything until he could get his dad on the phone to tell him what to do. And so if you don't prepare them for the transition to independence, like you're going to go on this trip, and after that you're going to move out and you're going to move to another state, you have to be prepared to handle this stuff on your own. All right. So now I want to talk for a minute about, everybody stretch and breathe. I want to talk about triage, okay? So we talked about a lot of like normal and whatever, but mental health triage, triage meaning the triage nurse is the nurse sitting at the front desk when you walk into the ER. So that's the person who decides how quickly you need to be seen and how urgent your problem is and who's going to see you, right? So if you walk in and you say, I have the sniffles and I think I need an antibiotic, you're going to wait for a long time in the ER. And if you walk in and say, I have crushing chest pain that radiates down my left arm and all the risk factors of a cardiovascular event, they're probably going to wheel you back in a hurry because you might be having a heart attack, okay? And so triage, likewise in mental health, involves a few things. One of them is basic first aid. So basic first aid in mental health is just soothing, comforting, looking at a situation. The child comes out of her room and she's crying and saying, what do you need? And helping solve the problem right there, right? And so, or it might be, oh no, we need to get a counseling appointment. We need to go to the hospital. It might be more than that. We need ongoing care. Something's very seriously wrong. And deciding that right up front. deciding, when are we really in a crisis? When do we need to get some advice from a professional who's been there is part of triage, right? So bandaging the emotional wounds and getting kids back on their feet. Sitting down with a kid who's had a breakup and saying, I know this is really hard, but you're going to get through it and you're a great kid, and I'm sorry this happened, and I want you to come to me if you're having trouble. That's triage, and that's basic first aid for a parent dealing with their kid. Soothing kids when they're struggling with a stage, maybe a kid goes through a little bit of early pruning and they're just having emotion regulation problems. They're just crying. And a parent saying, gosh, I know this is really hard, but I think that this is happening because of your age and your stage of life. Why don't you go get a snack? Why don't you take a nap? Let's see if you feel better. Don't worry, you're not stuck this way. Things like that. And then, emphasizing learning opportunities, I think, is part of that too. Saying, I know you messed up and I know you lost a friend over it, but I think it's important that you take this opportunity to learn that if you gossip about your friends, that, things go wrong and it's okay. This is a lesson that we learn. We fail tests and it's okay. And we can get through this and it doesn't have to be a crisis.